Hepatitis is a general term used to describe inflammation of the liver. So liver inflammation can be caused by several viruses, chemicals, drugs, alcohol, certain genetic disorders, or by an overreactive immune system that mistakenly attacks the liver called autoimmune hepatitis. Depending on its cause, hepatitis can be acute, which flares up suddenly and then goes away. Chronic, which is a long-term condition usually producing more symptoms and progressive liver damage. So today let's talk about the different types of hepatitis. So there are 5 viruses that can cause different forms of viral hepatitis. These viruses include hepatitis A, B, C, D, and E. Let's first talk about hepatitis A. Hepatitis A is mostly a foodborne illness that can be spread through contaminated water and unwashed food. So it is the easiest to transmit, especially in children, but is also the least likely to damage the liver and is usually mild and completely resolves within 6 months. Secondly, let's talk about hepatitis B. Hepatitis B can be transmitted through exposure to contaminated blood, needles, syringes, or bodily fluids, and from mother to baby. So it is a chronic disorder and in some cases can lead to long-term liver damage, liver cancer, and cirrhosis of the liver after many years of carrying the virus. Thirdly, let's talk about hepatitis C. Hepatitis C is only transmitted through infected blood or from mother to a child during childbirth. Hepatitis D is only found in people who are also infected with hepatitis B, whereas hepatitis E is predominantly found in Africa. Let's also talk about drug-induced hepatitis. So in drug-induced hepatitis, certain general safe medications can be toxic to the liver and cause hepatitis. So this happens when drugs are taken in excess or in very high doses. So these drugs include acetaminophen and even vitamin A. So today let's talk about the symptoms of hepatitis. Number 1, malaise. So this comes as a result of inflammation, immune response, and metabolic imbalance. Number 2, abdominal tenderness, especially in the upper right corner. This comes from liver inflammation and swelling. Number 3, fatigue. So this comes from liver dysfunction and toxin buildup. Number 4, jaundice. So this is the yellowing of the skin and the white portion of the eye. Number 5, dark colored urine. So this comes from bilirubin buildup. Number 6, light colored stool. Number 7, abdominal pain and nausea. This comes from inflammation, swelling, and bioflow disruption. What is done in the diagnosis of hepatitis? Number 1, physical examination. So this may or may not reveal a swollen or enlarged liver. Number 2, blood tests. So these are done to check the liver enzymes that are elevated when the liver is damaged or infected. Also, blood tests can check for the presence of any of the 5 viruses causing hepatitis. Number 3, ultrasound of the liver is done to detect any changes. Number 4, liver biopsy is done to confirm suspected inflammation. So it is also used to determine the exact degree of damage. So here are some few things you can note about the treatment of hepatitis. Firstly, to prevent infection, children or anyone who has not previously been vaccinated should be vaccinated against hepatitis B and A. The treatment focuses on preventing further damage to the liver, thereby reversing existing damage if possible and symptom relief. So in most cases, acute hepatitis will resolve on its own. In autoimmune hepatitis, certain medications may be used to help keep the overactive immune system in check and prevent further attacks on the liver. Thank you very much. I'm Mujib. Please follow me up, like my video, and share.